All right, perfect. So hello again. Good afternoon, good morning. I'm glad to open the third deep dive webinar for the Youth for Climate on climate and health for the 2025 Call for Solutions. It is great to see this big number of participants. So everybody please feel welcome. And I see that still people are joining, but I think we reached the critical mass. So let's start. My name is Pavel Faust. I'm part of the Youth for Climate team, and I will be the moderator for today's session. Firstly, a bit of housekeeping. We have interpretation. So let me first and foremost thank to our interpreters and also suggest you to join if you want to hear today's webinar in French, Spanish, or Portuguese. The links and the guide how to join will be posted in the chat. Also, in today's webinar, there is a space for your questions. So please, if you have any questions to what we are discussing today, you can put your questions into question and answer section or into the chat function. Finally, let me also share a bit of information about the Youth for Climate initiative and the Call for Solution 2025. As a Youth for Climate, we are recognizing the role of youth and the impact of that they have on shaping our common future. In Youth for Climate, we organize an annual call for solutions in cooperation with Italy's Ministry of Environment and Energy and with a range of partners. The 2025 Call for Solutions is a third edition, and we are looking for innovative ideas to tackle the climate change and its impact across several thematic categories. In the first and second edition, we've already supported 100 youth-driven innovation projects. As I said, we are really recognizing the role of youth, and so the Call for Solutions is open to youth change makers who are aged between 18 to 29 years old. So people between 18 and 29 years old can apply and propose their innovative solutions. Call for Solutions is open to all UNDP program countries, and you can apply either as an individual or as an NGO, a civil society, or a private sector entity. The key criteria is belonging to the youth-led category, which, as I said, is between 18 to 29. The call, which is currently open, is open for 2 more months from now. So the deadline on May 26, 2025 is still way ahead, and there is enough time for you to prepare your proposals and join. Coming back to today's deep dive, which is on climate and health, which is one of the thematic areas of the Call for Solutions. I'm very happy that we have amazing speakers who have a lot to share with you today. But I'm also sure that you might have some questions about the Call for Solutions and Youth for Climate in general. So please, if you have any questions about the general Call for Solutions, let me direct you to the frequently asked questions on the Youth for Climate platform, and let's use today's space of today's webinar just for the topic that we are here to discuss. Also, on the previous webinars, which we held last week, we had a deep dive into proposal development and a deep dive into an overall structure of the Call for Solutions. So you can also find them in the Youth for Climate platform. Finally, in today's session, we will look at climate and health. This is one of the new thematic areas for this year's Call for Solutions, and we will look at the importance of the intersection between climate and health on some of the key areas where innovation actions is most needed. And we will also learn about some tips for designing effective, sustainable, and just climate and health interventions. Without further ado, let me introduce today's speakers. First and foremost, we have Natalia Linot, who will talk about climate change as a health emergency. Then we will also hear from Sharmila Dhungana on Global Climate and Health Alliance. And finally, we will also hear from Mariam Bello, who is an awardee of Youth for Climate Call for Solutions 2023. Finally, at the end of today's call, we will have a Q&A session. Thank you so much for your attention, and let me pass the floor to Natalia.
Thank you so much, Pavel. Thank you. And it's so wonderful to see almost 200 participants already on this call from all over the world. I am truly delighted. So I'm going to start sharing my screen because I have a PowerPoint. It'll be pretty short because we do want to get to sort of Q&A. So let me start with sort of the objectives of our call today, which is, I know many of you in the room may know a lot about climate and health, but many of you may not. So this is to make sure that everybody is starting from the same level. I'm going to provide an overview in which ways climate and health come together, the way that climate change is creating a health emergency. And then really talking about the equity dimensions. UNDP is committed to leaving no one behind, and that means equity between countries, within countries, and the intergenerational, the future generations. And then together, the second bullet is the ways we will explore during the Q&A and with the 3 presentations, ways in which youth, practitioners, and policymakers can come together to implement new solutions. And your innovation is key to this. So let me start with a little bit of situating who I am. I am a social epidemiologist. This is someone who looks at health, not from a healthcare perspective. I'm not a medical doctor, but I'm someone who looks at how do the conditions where we live, where we play, where we grow up, shape our health. And this is my daughter many years ago, she's 11 now, holding a poster. We were at a rally because I believe that, being out there on the streets saying the climate crisis is a public health and medical emergency. So everybody's been sharing where they're from. I'm from Greece. And, my country has been engulfed every summer. We go home and there's a fire. And I'm worried about, how do we get away from the fire? How do I make sure that my 3 children are not exposed to the fumes? There have been floods. And then for the country itself, their biggest worry is the tourist industry, right? These extreme heat days last summer, a number of tourists died while going on hikes. So, I situated in where I am because the solutions should be centered in where you are. You know your community best. You know the people who are being affected, and it can take any dimension, the economic dimension, it can take the human toll, but today we're talking about health. And so health, if you're tagging through that proposal, is going to be the center of my talk. So this is a one slide. If you go away with like, what is the summary slide? And the WHO actually has really good slides. This is from the CDC. I've been using this one, so I'm going to use this, but the WHO has some great graphics. But it's important to recognize that the climate crisis doesn't impact health in one way. There are multiple ways in which it is impacting it, both directly and indirectly. And so your solution can also tackle just one of these pieces. It doesn't have to be a comprehensive, we don't expect one solution to solve the climate crisis, and we don't expect one solution to solve the health impacts. But let me give you a little bit of an overview about what those are. So in the news, we often hear about extreme heat and people basically dying during these extreme heat moments. We hear about floods and disasters, and obviously people are injured and hurt directly. What we often don't hear about as linked to climate change are the fact that we're seeing malaria or dengue in new parts of the world. We're seeing a vector ecology change, and not only in new parts of the world, but also at new times of year. We're hearing from our country offices that, they're having to spray for mosquitoes in wintertime, when that was never the case. We also know that the climate impacts are also there in terms of our water quality, our nutrition, the quality of, what we eat, and therefore food security. The rising sea level has implications also for the types of, whether we're talking about more salinity in our drinking water or more cholera because of the floods. So water access is something that has. And then for the climate and health community, a big area is air pollution. So we know that fossil fuel burning leads not only to climate change, but also to PM 2.5 and a lot of, pollutants in the air. So fossil fuel burning is causing climate change, is also causing air pollution that is impacting our lungs, asthma, but it's also impacting, pregnant people's ability to give birth to like healthy babies. It's also impacting dementia. So there are so many complex ways, and there's a rich literature for each of these. I'm just going to highlight a few in this presentation, but of course, this isn't to narrow you down because you can focus on any of these issues. But extreme heat and extreme weather events is something clearly that UNDP cares about deeply. We have an entire team working on disaster risk reduction and adaptation to sort of these extreme weather events. So as I mentioned, we saw a few years ago floods in Pakistan where 1/3 of the country was underwater. This causes tremendous immediate health impacts, the injury and the drowning. And it's important to highlight that there are some groups of people that are more vulnerable, whether this is outdoor workers because of extreme heat or people with disabilities who may not be able to flee as quickly during a natural disaster. But we know that extreme weather events and extreme heat are going to become much more frequent, and therefore the health of people is going to be impacted. So frequency and severity is what we care about. And from a health sector perspective, the question is, are we ready for this? Are we ready to address the increased heat stroke? Are we ready to address the increased illness and displacement and death? The next one I wanted to highlight, which I mentioned, is this sort of link with the animal world, right? In public health, we talk about it as One Health or zoonotic diseases. We know that with climate change, it's not only impacting humans directly, like I was talking about the heat, making it impossible for me as an agricultural worker to be outside, or for you as a tourist in Greece to go visit the Parthenon. So the heat is impacting us, but it's also impacting how we interact with the environment. And this includes insects and ticks and rodents. And higher temperatures are causing changes in rain patterns and disrupting our ecosystems. So this ecosystem disruption is truly one that will both directly and indirectly change where we see malaria. So this is a news article about mapping malaria in Africa, where we see other forms of diseases, and whether it's in the water like cholera or whether it's through vectors like mosquitoes. And we know that people who spend more time outdoors are at higher risk, but also there will be geographies. So what I'm trying to highlight here is keep in mind in your solution what is changing, not only in terms of the human impact, but in the environment of where you're trying to work. Is the temperature changing something about the seasonality of mosquitoes or the seasonality of what you're seeing in your community? The third one, which has been a tremendously understudied area, but particularly highlighted in the youth community, is the mental health impacts. So we know that climate change directly impacts mental health, and that's, whether it is survivors of, disasters. Clearly they have stress, depression, anxiety, PTSD if you're forced to flee. But we're also seeing higher levels of suicidal thoughts, not only among young people, but also within countries. There were a spike in farmers' suicides in India. This mental health toll is one that has been relatively understudied, but one in which we have been hearing, especially from our youth sort of community members, it is real. This eco-anxiety of the future, it is real. And so we're highlighting that children, as well as older adults, are more at risk, pregnant and postpartum women, and people who are already living with mental illness, right? Homeless people who have less resources, as well as first responders during emergencies. So I highlighted only 3 types of issues, right? The heat and the rodents and the mental health. But you might be someone who really cares about asthma and air pollution, and that could be your focus. But what I want to stress, and what is really important in our view of how climate impacts health, is that we need to focus about inequalities and the inequities both within and between countries. As everyone on the call probably knows, the countries least responsible for the climate crisis are also the ones being impacted the most, and the ones that have the least resources to adapt to the crisis. So the inequities between countries in the global north and the global south are critical. And if your solution focuses on those inequities, whether it's through a transfer of knowledge, south-south learning, that will be great. But also don't forget that there are inequities within countries. And this is true in wealthy as well as non-wealthy countries. So disabled people are, people living with disabilities are at risk of kind of the health consequences quite directly. But people of color in the United States, in the United Kingdom, in Greece, are often exposed to more toxic pollution, whether it's air pollution or living near fire pits that are open fire pits. And obviously, a piece that we want you to think about is the gender inequities. There are gender inequities, both in terms of who is at the table, in terms of the solution, but also in terms of who is feeling the pressure. And for health, some of the gender inequities may fall across sort of reproductive health lines. Do you have access to sexual and reproductive health? Do you have what you need during, pregnancy in the future? But they also come down to gender roles where, if you expect women and girls to collect water, and water is becoming much more scarce in your community, that means that women and girls are traveling much further, exposed not only to the environmental risks, heat, etc., but also risks of violence, risks of, to security, etc. So there are deep inequities that your solutions could focus on. And of course, when we're talking in the context of youth, I think it's really important to highlight that climate change is really not only a intra-generational, but an intergenerational equity issue. And, if you haven't heard this term, intergenerational justice is basically about obligations of current generations, our generation, not to pursue policies that create benefits for themselves, but impose costs on those who will live in the future. And so there are real risks to the climate links and pandemics of the future or the anxiety. But what I have been finding hope and where I feel tremendously excited to be part of this call is that youth-led climate action has been at the forefront. This is whether it's through lawsuits that I'm highlighting in this slide, but also through the solutions. So the solutions is what the focus of today should be about, but I wanted to give you a little bit of the background. But there can be solutions at many different levels. So I only have one slide on solutions, and then I'll pass it to our colleagues who will talk more on solutions in the Q&A. But for example, if you're thinking about heat, your city or your country may have a heat plan, but you may identify a group of people that have not been reached through that, whether it's elderly people and you consider, could you put in place some sort of early warning system for old people? Because, really what happens during a heat emergency, people who live alone, who are isolated and at risk, are at highest risk of dying. So your plan could be an app to check in on isolated elders in your community. Or it could be something working on a cooling center, saying that you work with businesses in your community to open up their shops to people during, 12 to 4 p.m. when it's really high heat, to allow people who don't have access to air conditioning, if there's a mall in your neighborhood, your solution could be some sort of engagement with the private sector. I'm just throwing out ideas, but there are so many ways. And I think what will be important is to think about what is already happening. If there's a complete gap, then you have a lot of flexibility as to what your solution can bring in. But if there is work happening, then you might be more targeting a group that has been left behind or forgotten, or a group that is not getting access to the information because of linguistic or other sort of barriers. Refugee community in Greece, for example, the Roma people often get left behind in national policies. So it is up to sort of a creative way of thinking about it. So your solutions can span the policy, the advocacy, the technology, the working directly with healthcare providers. So, and it can be from the prevention to the response. We want you to be open and to really be thinking about how is it serving people? How is it ensuring that there's an equity dimension and that you're not serving only, the wealthiest people in your community? And which health outcome are you most at interest? So is it that you're focusing on asthma or heat strokes or unintentional drowning? There are many, many different ways, or malaria. So with that, I'm going to pass it on to our colleagues before going into the Q&A. I'm going to stop sharing and thank everybody for being on this call.
Thank you so much. Thank you so much, Natalia, for shedding lights on the various aspects of climate and health emergency. And I think importantly also in your message, you mentioned that one solution is not expected to solve everything, but you showcased the broad nexus of themes that connect under the climate and health, and the importance of locally driven innovations and solutions. We also see that some of the issues you mentioned resonated very well with the participants, and also people in the chat were mentioning air pollution, mental health, extreme heat, among the topics resonating with them. So with this, let me remind everybody that the Q&A and the chat function is open, and I will pass the floor over to Sharmila. Floor is yours. Mike.
Thank you so much, Pavel. Hi, everyone. Thank you so much for having me. My name is Sharmila, and I'm the member and youth coordinator at the Global Climate and Health Alliance. It is really a pleasure to be here and talk about youth leadership on climate and health action. Today, I'll be sharing particularly about GCHA's Youth Climate and Health Network and highlight how our youth members are driving change in various ways as advocates, communicators, problem solvers, and community builders. I included this photo in my first slide from COP29 in Baku because a lot of our youth members are present here. Moving on to the first slide, next slide, please. YCHN is a platform of over 200 youths across the world working on the intersection of climate and health. Our members are health professionals, including doctors, nurses, pharmacists, they're students, researchers, they're also climate activists and journalists, all united with a shared goal of driving climate and health actions. The members meet virtually bi-monthly to connect to one another, share their ongoing projects, share relevant opportunities with one another, and discuss ongoing critical issues on climate and health. They also meet in person in forums such as COP. Beyond the meetings, they connect via a Google group and a WhatsApp group chat where they regularly exchange information on different opportunities and highlights from their work. The network is open to all youths, climate and health professionals aged 18 to 35. So in a bit, I'll also be sharing the link to for you to learn more about the network and apply if you think that's going to be relevant to your work, and we'll be happy to review your application. Moving on, we actually had a bi-monthly meeting just last week, and I've included here a screenshot of the word cloud on members' response to the question, what are some of the most urgent climate and health issues today? And a lot of the members' responses actually are very similar to what Natalia has already shared in her presentation. So I will be a bit brief in this section. Looking at this, we can see a breadth of challenges that members have identified. Some have pointed out systemic gaps like weak policies, lack of expertise, and inequality, while others have identified some of the direct impacts of climate change, such as climate anxiety and associated mental health struggles, and also physical impacts of natural disasters. A significant concern is also dual burden of climate, where communities are facing not only immediate health impacts of climate-related events like heat waves, flooding, wildfires, but also worsening of pre-existing health conditions like respiratory illnesses and malnutrition. Nutrition insecurity has also been identified as a pressing concern. Changes in weather patterns such as droughts, floods, irregular rainfall affect crop production, which then leads to less food availability and lesser quality of food, leading to poor health outcomes. Additionally, another pressing concern, energy poverty, where communities lack access to reliable and affordable energy, further adds to these challenges, making it harder, especially for vulnerable populations, to respond to climate change impacts. As we move to the next section, I wanted to shift the focus to explore how the youth network members are working in their communities to address these pressing issues and drive positive change in their communities. And in the following slides, as I share specific examples of youths from our network, I hope it can also help you give an idea of the type of work that you might want to pitch to the call for solutions. Starting with youths as storytellers and communicators, here I would like to share an example of one of our network members, Kate Okuri, who is a freelance journalist covering stories on climate and health. In the first article, Kate covers the story of a mentorship project in South Africa where the organization Black Girls Rising is training girls between 12 to 18 to lead climate actions in their communities. Within the project, the girls are paired with local organizations to lead campaigns on areas such as clean air, sanitation, and food security. In the second story, Kate discusses the interconnectedness between climate change impacts and women's mental health in the particular context of Kajiado County in Kenya. As rainfall patterns become less dependable, women have to travel longer distances to fetch water, especially during arid months, something that Natalia had also mentioned in her slides. And unfortunately, this has put women in danger in this community from sexual predators who prey on women walking alone. This had become a constant source of anxiety for women in these communities. And this article talks about an initiative pioneered by a local woman about a model village designed to be both climate resilient as well as to prevent instances of gender-based violence. The article elaborates how this village, consisting of 63 households, is setting an example with sustainable programs around water, clean energy, and sanitation, but at the same time has been implementing more gender equal practices as well. These examples show how young people can play an important role in shedding light to the local and regional challenges that are often overlooked or don't get enough attention in global stage and in global conversations. In our next slide, with youth as advocates and educators, I'd like to share about one of our members, Aishat Oduye, who's also a medical doctor and has been working with local communities in Nigeria to raise awareness about preventive healthcare, focusing on connections between environmental degradation, pollution, and the increasing burden of diseases. Aishat has also been actively engaged in global climate dialogues, as a part of the 11th meeting of the Facilitative Working Group for Indigenous and Local Communities in Bonn, Germany. She advocated for the inclusion of youth and community voices in climate and health discussions. Moving further, moving to the next slide, one of our other members, Finya, is a mental health consultant who's working with different stakeholders on creating a comprehensive mental health and psychosocial support intervention map, specifically addressing mental health needs in the context of climate change. In addition, Finya is also involved in planning the Nordic MHPSS conference in fragile and humanitarian settings, with climate change as one of the core themes. One of our other members, Ilona Irizi, sits in the governance committee of the Climate Sensitive Infectious Disease Network, or CSID, which aims to support innovators, implementers, and researchers to co-design and develop these CSID tools to address climate-driven infectious diseases. These examples demonstrate powerful impact that young people can play in shaping conversations, influencing policies, and driving actions at various levels. Moving on, I'd like to highlight how our members are working as knowledge builders, contributing to the existing knowledge base in different aspects of climate and health. Here, I've included a few examples of ongoing research, from examining the effects of different climate variables in cardiopulmonary emergency admissions in hospitals in Cameroon, to exploring healthcare professionals' attitude towards climate change in a hospital in New York City, to studying the impact of forest fires on emergency room admissions in Halifax, Canada. Our members are working to enhance the knowledge base and provide valuable insights into the climate health connection. Moving on, I'd like to also share about the important role of youth as connectors and community builders. One of our members, Leah Osania, has supported a project that empowers young artists in Somalia to use their art as a tool for bringing communities together and initiating conversations about climate and health actions. By showcasing their work in community exhibitions, this project has created space for dialogue in sustainability and climate resilience. Additionally, many of our members are involved in other global networks, such as the Youngo, Official Youth Constituency of UNFCCC, Association of Southeast Asian Nation, or ASEAN, Common Commonwealth Youth Health Network, where they continue to build community and strengthen their collective influence. With this, I would like to end my presentation and share that Youth for Climate's Call for Solution 2025 is an incredible opportunity to enable youths to make a larger impact in their communities. I'd like to wish all the best to potential applicants, and we'll definitely be amplifying this call in our Youth Climate and Health Network as well. And like I mentioned before, sure, I'll be sharing the link in the chat where you could apply to be a part of the network. Thank you so much.
Great. Thank you so much, Sharmila. It was very interesting, and I see that it sparked a lot of also questions in the chat, including how to join this coalition. So very much looking forward to also receiving the link from your side. And please, everybody, keep in mind that you can ask specific questions also to Sharmila if you want. So please use the chat function. And with that, I'll pass the floor to the 2023 Youth for Climate awardee, to Mariam Bello. Mariam, floor is yours.
Thank you so much. It was really interesting to hear all of the solutions Sharmila talked about, because it was like really similar to things that I've done, and I'm so happy about that. So my name is Mariam Bello. I'm the co-founder of Pakas Mobile Clinic, and I am a 2023 Youth for Climate awardee. And so I want to say thank you so much to the Youth for Climate team for all the support that they've given my organization and in ensuring that our projects came to life. So yes, with the support of Youth for Climate, we launched the project Pakas Resilient Healthcare. And a little bit of backstory. So before then, we were just focused on providing healthcare accessibility to underserved communities, And then during the before the 2023 call for solutions, we made a lot of research about the intersection of climate change and healthcare, because I've been doing stuff in climate education, but not particularly healthcare. And so that was when we realized like there's a lot of connection that people don't talk about. And you can see that I was the only person doing something in healthcare as of 2023 as a Youth for Climate awardee. So our goal was to help create accessibility of healthcare, because we are focusing on flooding. And so in the southeastern part of Nigeria, there's a lot of flood going on. And this is the region where we've been operating. And so because of the high level of flooding and the fact that mobility becomes an issue during climate-induced disasters, we figured out telemedicine was going to be the best way to address this. And so with the support of Youth for Climate, we started the Pakas Resilient Healthcare, developed
Mariam, I think we lost you for a second. Mariam, are you here with us?
Can you hear me?
Yes, now it's good. But I think the past 30 seconds, we didn't hear anything.
Oh, wow. I'm so sorry about that. Sorry about that. So yeah, basically I was saying, and if you cannot hear me at any point, kindly let me know, please. So I was basically saying that we integrated telemedicine to ensure healthcare accessibility for our target audience, given the fact that mobility is usually an issue when there's flooding. And then we have healthcare professionals here. You know that diseases becomes more prevalent, as my previous speaker said earlier. And Natalia mentioned something about not just serving the rich people in your country. So it was more of a matter of healthcare accessibility and health equity. And then the project is called Resilient Healthcare because, we also figured out that data accessibility is also an issue, especially when it comes to healthcare. And it's very important when we're talking about resilient healthcare. So during the integration of our project, we formed a partnership with Hikma Health, which helped us integrate electronic health record system into what we do. And then during the process of running this project, because there was a lot of learning, learning during the process, and it was the first time we're implementing this project, we also figured out that some people or some communities, especially in rural communities, very hard to reach communities, insecurity was a challenge. And at the same time, accessing the internet would be an issue for some people, which means that telemedicine was not going to serve all of our target beneficiaries. And so we integrated a non-toll-free call number, which we've been using and getting consultations. And then because we're targeting people who don't have access or may not necessarily be used to adopting technology, we had a lot of outreach sessions and trainings with community health workers. And then we also try to reach our target audience by leveraging community leaders, to bring this new form of solution to them that they are not used to. And so, yes, that was one of the things we did. And then when you look at the issue of climate change and healthcare, my previous speakers already did a really good job in highlighting the challenges. And on the nutrition aspects, we had discovered that nutrition was a problem. So in order for us to address this, given the fact that 70% of our target beneficiaries were women and children, we integrated the outreach for micronutrient delivery for those parents or pregnant women that may be malnourished, improving the healthcare outcomes of people. And then we've done a lot of stuff. I know Natalia said something about you cannot do everything, but we've made a lot of discoveries during our implementing our projects. And so, yes, we integrated a solution for micronutrient malnutrition. We focus on training healthcare providers. Training healthcare providers because we had issues with healthcare professionals understanding this challenge. And then we did a lot of health outreach. We did we were able to reach over 21 local government areas and in 3 states within this duration. That was actually last year. And so we did a lot of health education as well through monthly webinars for our project, because we discovered during the process that a lot of people did not understand the intersection of climate change and healthcare, and people did not know that climate change was related to the challenge that they were having. And then we also increased our target beneficiaries to older people, given the fact that climate change affects people, especially those that already have chronic diseases, and accelerates the challenge. So this was one of the things that we did. We did tech, we did innovation, but it was more of a matter of learning and ensuring that we were not forcing a solution onto our target audience, but learning about their needs and then integrating that into our approach. And then during the process, we were also able to form additional partnerships and get more funding to ensure that we implement and scale the projects. So yeah, that's basically about what we did. Thank you.
Thank you to Mariam. This was also super interesting, and I see how both what you said, Mariam, but also what Sharmila and Natalia talked about, how there is from all 3 of your interventions, there is on one hand, it's very clear how broad the area is, but you are all touching upon very similar points and key considerations, which I think is very important. And we can see that there is a very broad area where innovations are needed. Maybe also, Mariam, from what you said, I think the importance of keeping the principle of leaving no one behind was very important. And you also rightly noted that we may sometimes encounter people who are reluctant to change or to try some new approaches, which maybe brings me to a first question that will go over, maybe starting from Natalia, but also to others. How can we as youth engage our own people to bring them some climate awareness, and how we can change the mindset about in our own communities if some people are, for example, opposing to using new technology and improving their life, even though they know that maybe current situation harms them. Over to you, Natalia. Thank you.
Thanks so much, and I'm sure Sharmila and others can jump in. So the question of behavior change and changes in opinions around the climate crisis. There's been a lot of evidence, actually, who are the good sort of trusted voices. And at times, for those of you in the room who are listening who are nurses, in many sort of polls that have happened, at least in the United States, but I think international too, nurses are one of the top most trusted voices, even more than doctors, more than politicians, more than other people. But for the youth component, interestingly, among climate deniers in the United States, 12 to 13-year-old girls are the most likely to convince their parents to care about the climate challenge. And, you know, we've seen this literature in the health community also with, you know, anti-tobacco and, you know, how to get people to smoke. So actually young people, you know, thinking about we often think about the voices of the most, you know, educated, the climate scientists or the politicians or the doctors, but actually young people have really been able to change hearts and minds. And, you know, in some communities, the messaging is around stories, you know, really talking about the people who you have seen be harmed by this. The data is important, you know, in other communities. So it depends on the audience, you have to change. But I think what is important for this call is recognizing whether you're trying to nudge people to take a behavior, but you know everybody agrees that this is a problem. So in your community, maybe everybody knows that climate change is a community because you feel it. You see the heat every day, you see the rains, you know, you don't need to convince people that it's a reality. You're trying to convince people that your solution will work. In other places where you might be in a community that is emitting a lot of you know, fossil fuels, and really people don't want to talk about it because they're scared that they'll lose jobs, you know, you might need a different narrative. So there is no one solution, but recognize that narrative and communications is key to all of this, and that the health narrative is often a very powerful, non-political one, because everybody can talk about, you know, a person that they know who's directly being impacted, whether it's a child with asthma or a grandparent who drowned, or, you know, I mean, I'm saying really extreme things, but people have faced really extreme consequences. Sharmila, is there anything you want to add around behavior change?
I was thinking along the same lines, Natalie. I was also thinking in terms of including health impacts of climate change in the school curricula already, so that children from a young age are already aware of this on an intellectual level. And like you said, on its health impacts are so evident that many people are already experiencing it in their lives, and if we add that with the knowledge from their curriculum, I think that might make them more open as they grow older about the
I wanted to
effects of climate change.
highlight just one thing that actually we did with GCHA, which is a discussion on misinformation. So one of the risks to behavior change is that, you know, the fossil fuel industry is pouring millions of dollars in sort of blocking the narrative of, you know, climate and health and the impact. So recognizing that young people can also be important in highlighting when there is a piece of misinformation, or where they're trying to sort of say, no, this wasn't because of fossil fuel burning, but, you know, it's God's will or something, you know, and I am a religious person, so I'm not saying that it's a bad thing, but this concept of, you know, that there is not only the narrative of truth around climate and health and the data and the evidence, but also there's being pushed a narrative of, you know, if you try to address the climate crisis, we're going to lose jobs, or people aren't going to have access to energy. Clearly, our top priority is ensuring people have access to energy that is clean and healthy, not to deprive people of that right. So misinformation is a very important piece, and there could be some interesting proposals around that, around, you know, how do you fact check? You know, so we're throwing out some ideas there. Pavel, back to you to the next questions. I know that we have a lot of questions in the chat.
Yes, that's true. We have a lot of questions. It's a big topic, but one of the questions was about how health solutions, which are not essentially a product, how they can be adaptable and scalable, and what partners maybe innovators can engage with in their efforts to make their solutions sustainable and scalable in the future. Over.
That's a great question, because it's easier to imagine a technological solution that goes to scale, right? Putting solar panels or thinking of some off-grid solutions, those are really important and really, really great. The way I think you can think about scalability when it comes to policy is, who are you influencing? And is your solution going to provide new evidence and new partnerships potentially? So let's give the example. I know somebody asked about this. I mentioned, you know, innovating through setting up new cooling centers in a mall. If your solution had new partners with the private sector, buy-in, and you sort of could build a model that others could replicate, or if there was new citizen science where you're measuring the uptake of this, and that it's not bad for business because, you know, you could think about your solution as what would be the barriers to this? You know, maybe the shop owners would think, no, you'd have all these people in the store, nobody would buy. So you know, you do a pilot for, and you know, I'm throwing out ideas again, Pavel and Lydia and Roxani, please jump in and say if this is inappropriate for this call. But I could see a very useful pilot where you're sort of building new relationships, a new idea into a new setting that then you basically prove that this should be up, you know, scaled up in other cities because it worked. It worked in your 5 pilots. It didn't cause a decrease in sales and actually saved lives because people, you know, things like that. So thinking about new partnerships and scalability through like a private sector model is one. The other is through a policy model and influencing a government, your you know, your nationally determined contributions and putting in something through there through a youth lens. So there is a lot of scalability can happen in the policy space, not only in the technological space. I'm going to ask actually you know, Pavel, if you have anything to add, or Roxani on that question, because I think it's an important question.
I think maybe before we pass the floor to Roxani, the point on you test something, and when you have an example of something working and being, you know, presentable, then that is usually a very strong argument for moving forward. And maybe also some of the awardees from the previous years are now basically in this space right now. And also throughout the Youth for Climate call for solutions and implementation, there are opportunities to learn and to develop also some of the capacities within the implementation teams. But over to Roxani, if you would like to add anything.
Sure. Hello, everybody. This is Roxani Rashasa, Coordinator of Youth for Climate, and thanks so much to the presenters for the great presentations. Yeah, I think the question is coming because scalability and replicability is one of our evaluation criteria, right? So the potential to scale and replicate the solution, and you'll be asked about this on the application form. Just to say, we think about scaling quite broadly. So traditionally, you might think of scaling in numbers or bringing the solution to more communities or to more countries, or maybe even scale globally ultimately. But we can also think of scaling as scaling deeply, and over time making sure your solution is more deeply shifting values in communities. So we don't have a very narrow angle, let's say, on what we mean by scaling, but very helpful to have your perspectives, Natalia and Sharmila, in terms of any partnership opportunities in particular linked to the health sector. And just to say thanks to the participants for all the questions in the chat, and great to see some concrete examples that you're mentioning. We're open to a full range of the broadest range of climate and health solutions, as long as they're aligned with our evaluation criteria, which you'll find in our guidelines on our application page. Yeah.
Pavel, I see a question that I wanted to talk about in the chat around zoonosis. So there's a question that's saying, are climate health challenges solutions that directly contribute to animal health welcome? And someone has also added that, you know, deforestation is an important question in zoonosis, which is true. As long as you can link it back to human health, so it's a One Health approach, not just animal health. So One Health is humans, animals, and ecosystems, so also deforestation, it would be welcome. If you're only thinking about it through animal welfare, I think we wouldn't pick it up, because UNDP and, you know, it's a little narrower for an intersectional view. But if, you know, but obviously zoonosis, and that's why I wanted to highlight it in my presentation, is very important, as is deforestation, as is kind of our relationship with our habitats. So you could think about a solution, for example, that reduces the need of people to go deeper and deeper into forests for food by, you know, and again, I don't know what that solution would be, but we know that is, you know, unplanned urbanization as well as climate change is causing communities that typically knew how to engage with, you know, with the periphery, forests and stuff, to be going deeper in and being exposed to bats and other sort of animals that carry diseases. So it is important to think about the relationship, but I don't think a solution that was only focused on animal welfare would likely be one that we would highlight. But if it had that, three-piece, animals, ecosystems, and humans, it would be a very good solution.
Thank you. It was actually a question I had in the pipeline. And while I promised that we wouldn't talk in general about the call for application, this little bit touches on the fact that the applicants need to pick one priority, but since there is 6 priorities, it is also very welcome if the projects and the solutions are tackling a multiplicity of them, because they can be complementary and one does not have to kind of block the other. And moving on with the questions, there's also a question about how to tackle or how to handle a meaningful engagement with the communities where some new developments are taking place, because the new developments often have or can have negative impact on health. And in some cases, in some places, there's very little public engagement, and kind of the developing side does not really discuss with the local communities. So if this is something where we have any good examples and practice, and I think I'm looking at all our panelists, and I see Natalia, you were smiling when I was reading it. So over to you.
Yeah, and I don't want to take all the speaking time, so Sharmila and others jump in. I mean, I think this is where we are looking for innovation, right? I'm not going to give you an answer to that question because that's a critical question. So communities may not be engaged, they have no space in the political process, or there might not be public conversations. So maybe your solution is to work with local politicians to have kind of a public forum. It could be that there are public forums, but people are really busy. They're at school or working and they're not able to engage. So thinking of a web-based or, but I do want to highlight that somebody in the questions highlighted that in communities where there's not enough tech, what are these tech solutions? There are some low-tech options that I have seen where, you're using not a smartphone, but the old phones to, communicate. Or if you don't have phones at all, then clearly your solution should highlight that, it's addressing this gap that this community doesn't have, and therefore we're doing a more, paper and pen sort of engagement. So I don't think there's a simple answer to this question. I think what you have identified is a problem in your community, that there isn't engagement with community members in big, and then your solution can build from that. Sharmila, I don't know if you want to add to that, or Mariam.
Yeah, I wanted to talk about one of the projects that I was involved with on disaster risk reduction. It was about community-based flood early warning system, where this early warning system was a tool put in between Nepal and India, because the countries share many transboundary rivers. And then when flood starts, it starts with the upstream community and then moves to the downstream community. So it became a tool. It was planted upstream, and then as the water level started rising, alarm would go on, and then the community would actually notify the downstream community in parts of India that flood is on their way, and then that would give them some time to go to higher areas, evacuate, and so on. In the beginning, the community was sort of reluctant because it was a new technology, and it required coordination with people they had never met. And so, but then as time went on, and as the community members got to see actually the potential and how it could really be a tool for adaptation against to lower the flood impacts, it actually became more popular, and community members started taking more ownership. And then it came at a point where even municipalities were agreeing to pitch in their own funds to run the project. So in my experience, it has been a great example of how with time and once the community is sort of warming up to the technology, there can be changes. So maybe, not to be disheartened if it seems like something that might not work on the first go, because there are examples of when it has been possible to significantly enhance community ownership.
Thank you both. Thank you both for sharing. There was also one question in the chat about plastic pollution in water sources, in river, in the environment in general, and how does this kind of interact with the climate and health, and whether this would fall under the category?
Yeah, so plastics are clearly an issue in and of themselves. It's not in the climate and health. I mean, the production of plastics can have harms. We in the climate and health community have not focused on plastics because there's an entire other community that is dealing with plastic. But so I'd be a little hesitant, as that type of pollution is important for health. Obviously, not only plastics like bottles, but microplastics. But often it's not as directly linked to the climate crisis. I also saw a number of questions, and Sharmila, and I'll welcome you to answer that too in case you disagree with me. A number of people were talking about energy, and I think, Pavel, to your point, that is there also an energy specific call and linking the two, because they are very clear, or am I wrong about that?
No, you're correct.
I'm correct. Yeah. So I think the energy, health, climate nexus is a very strong one, especially through, and I want to take a minute to talk about that air pollution, indoor air pollution. I saw some people talk about indoor, cook stoves. That has been one solution that we really think about, because indoor air has a tremendous inequitable impact, especially on women and children who are indoors more during the day and responsible for the cooking. So solid fuel burning, whether it's due to, just wood or, that there's an inequitable. So access to clean cook stoves is important, both from a clean energy and, climate challenge, but really important from a health perspective. And then the broader energy, there's been energy solutions that UNDP has been involved with, for example, solarizing health systems in Zimbabwe. UNDP was involved over the last 10 years, even more, putting solar panels not only in point of care so that women are not giving birth in candlelight, but also solarizing the entire vaccine supply chain so that you don't have suddenly a power cut and the vaccines that you have for people, or for example, treatment, you lose power and you don't have the correct temperature. So there's a lot of energy, health, climate interventions that and solutions that have been tested and are really good. So I do want to highlight that that's an area where there could be a lot through the air pollution, as well as the sort of health sector resilience thread. But Sharmila, over to you to add to any of that. I see we're almost at time, Pavel. Yeah. Sorry.
I don't have particularly something specific to add, but I definitely agree with you, coming from Nepal, and where the common practice in many of the rural villages is firewood. And there have been a lot of study on the impact of firewood on respiratory diseases, and then there's also ongoing effort to shift to alternative energy sources. So definitely encourage potential applicants to look deeper into this.
Thanks so much to both of you. And I think since we are reaching the time that we were planning for today, I think we will close the session for now. But in terms of questions, since there are still some of the questions coming to the chat, and some of them are also related to the call for applications in general. So please let me again highlight that you can follow the social media of Youth for Climate, and you should join the platform. Once you register, you will be a member of over 22,000 young change makers who are discussing exactly the kind of questions that you might be having. So please become part of the community. We also have frequently asked questions, and if you do not find your answers there, you can also ask a question and you will receive an answer. That is one of the important parts. Also, let me highlight that this was the third out of 5 deep dive webinars. We will have 2 more on Wednesday and Friday. These are again about the specific thematic areas for the call. And then if you go back on the platform for the webinars that we had last week, you can also learn about the call for applications in general and about how to design your proposal. I think this is also an important part because some of the questions were asking about how to scale up your solutions. And I think you can learn a lot of information from that webinar on how to think about scaling and future-proofing your solution in the design phase. With that, I would like to thank so much to Natalia, Sharmila, and Mariam for joining today as panelists. I'd also like to thank the Youth for Climate team, all of you for joining, and last but not least to our interpreters who made this possible for everybody in different languages. Thank you so much. And hopefully stay tuned and see you in 2 days' time again, the same time.
Thank you so much.
Thank you all.
Bye-bye.
Bye.